Good day, and welcome to today's Medicare 101 webinar, where we're going to discuss the basics of Medicare planning. Medicare can seem confusing and overwhelming, but it doesn't have to be that way. What makes Medicare confusing and overwhelming is the amount of information overload, the amount of information the insurance companies send to you as you approach your 65th birthday, and then again every fall during the annual enrollment period. It's that amount of information that makes Medicare difficult. Our brains just shut down. Today, we're going to discuss what Medicare covers and does not cover, and your two options for filling in the gaps. Medicare is the intersection of your health coverage and financial wellness. My name is Andy Firmin. I am the owner and founder of Benefit Advisors Group. We are a Massachusetts-based Medicare planning advisory firm helping individuals understand the intersection of their health coverage and financial wellness. We help you demystify Medicare and understand the ABCDs in the coverage that is most appropriate for your situation. During today's webinar, we're going to discuss when do you sign up for Medicare and when are the enrollment periods. Are you required to enroll in Medicare? And if you don't, will you have a late enrollment penalty? What if you're still working past the age of 65? Do you have to enroll in Medicare? We'll discuss that as well. We'll review how you sign up and enroll in Medicare, and we'll review what original Medicare Parts A and B cover and does not cover. We'll review your prescription drug coverage and two ways for you to cover what Medicare does not cover. We'll discuss why you might choose one option over another, as well as protection plans to protect your financial wellness. Let's create a partnership for your health coverage and financial wellness. The first question is, are you required to enroll in Medicare? We get this a lot. If you fall into one of the 5 categories on your screen, it is in your best interest to enroll in Medicare. These situations are if you are no longer working, if you are on COBRA insurance, if you have TRICARE, if you are on a small employer group plan, that is a employer group health plan that has 19 or fewer employees. And finally, if you are on a marketplace or an ACA plan, it is in your best interest to enroll in Medicare Parts A and B. When do you sign up for Medicare? You have an initial enrollment period that runs for 7 months around your birthday month. It is 3 months before the month of your 65th birthday, the month of your 65th birthday, and 3 months following the month of your 65th birthday. If you miss that enrollment period, you do have a general enrollment period that runs from January through March of each year. And you may have a special enrollment period that allows you to enroll in Medicare Parts A and B at various points throughout the year. For example, if you delay your Medicare Part A and B because you have creditable employer group health insurance, when you leave that plan, you will have a special enrollment period allowing you to enroll in Medicare Parts A and B without a late enrollment penalty. There is some paperwork that you will need to fill out, and your employer will need to fill out some paperwork as well. And finally, every year from October 15th through December 7th is the annual enrollment period. This is a time for you to review your current coverage, your current needs, and make any changes for the following year. It is especially important to review your prescription drug coverage annually, as your prescriptions may change throughout the year and the insurance companies may change how they cover the prescriptions. How do you enroll in original Medicare Parts A and B? If you are already collecting Social Security, you will be automatically enrolled in both Medicare Parts A and B, and your card should arrive in the mail sometime about 3 to 4 months before your 65th birthday month. If you are not collecting Social Security, you will have to manually enroll. By far the easiest way to enroll in Medicare is through your online Social Security account. In fact, the hardest part of this process is actually going to be either creating your account for the first time or logging into your account. You're going to want to make sure you have your access to your email as well as your cell phone, as Medicare Social Security will send you a one-time passcode. And if you have not yet set up your Social Security account, you're going to want to do that ahead of when you need to enroll in Medicare, because Social Security may send you a hard copy code in the mail, which you'll need to finish enrolling and signing up for your account. Now, enrollment assistance. we help our prospective clients enroll in Medicare Parts A and B online all the time. We also provide assistance for those who have delayed their Medicare enrollment because they're still working. We provide assistance in navigating the forms that are required, making sure the forms are completed accurately and submitted in a timely manner, therefore helping prevent any delays in your coverage. What is Medicare? We've all heard the ABCDs of Medicare. Let's break it down for you. Your Medicare Part A covers hospitalizations. For most people, there is no premium. You have premium-free Part A coverage. What is really important to understand about Medicare Part A is there is a $1,676 deductible per occurrence. Now, this verbiage of per occurrence is really important. Throughout our working lives, we have viewed deductibles as being annual. Once we satisfy that deductible, we're good for that plan year. This is not the case with your Medicare Part A coverage. What this per occurrence means is if you are hospitalized multiple times throughout the year, you may have multiple $1,600+ deductibles. Medicare Part B covers doctor's appointments, durable medical equipment, lab work, things of that nature. There is a monthly premium for your Part B coverage, and in 2025, the base premium is $185 per month. That may be higher based off of your income calculated 2 years prior. Now, there is a $257 annual deductible for your Part B coverage. What's really important to know about Part B is after you satisfy that $257 deductible, your Part B coverage is what we call an 80-20 plan. That is, Medicare only covers 80% of your doctor's appointments. You are on the hook for 20%. And unlike your current group health insurance, there is no maximum out of pocket. The maximum out of pocket is the ceiling or the cap on how much you will pay in any given year. There is no cap under your Part B, so your 20% expense may be as high as your healthcare needs are in any given year. In essence, that is simply what Medicare is. Your Part A covers hospitalizations. There's a $1,600+ deductible per occurrence. Part B covers doctor's appointments, lab work, medical equipment, things of that nature. There's a $257 deductible, and Medicare only covers 80%. We have not talked about dental, vision. We have not yet talked about prescription drug coverage or hearing. And of course, there is no help with long-term care under any Medicare plans. Okay, you have two options to fill in the gaps of what Medicare does not cover. You have two ways that you can cover that Part A deductible, the Part B 20%, and add in those ancillary benefits that Medicare doesn't cover. Your first option is through a supplemental plan or a Medigap plan. We use those terms interchangeably. Option 2 is a Medicare Advantage plan. This is what is known as Part C. Let's break each down. First, Option 1. Option 1 will be original Medicare with a Medicare supplement or a Medigap plan. Medigap plans are offered by private health insurance companies, and they help fill in the gaps of original Medicare. Your Medicare supplement plan, depending on which one you choose, may cover your Part A deductible, and it may cover the Part B 20% coinsurance. Now, if you go with option 1, you should add a standalone prescription drug plan. And if you need some ancillary benefits, you may want to add an optional dental or vision plan. The really nice thing about option 1, you can see any doctor, any facility across the country that accepts Medicare. It does not matter who the insurance company is. The other nice thing about the Medigap Medicare supplement plan is after you make your monthly premium payment, your expenses, out-of-pocket expenses when you go to the doctor or the hospital, are somewhat limited. The downfall is you're paying an upfront monthly premium for your Medicare supplement plan regardless of how often you use it. You may be paying a second premium to the prescription drug company as well as a third or fourth premium to a dental or vision insurance company, and that is on top of the $185 that you pay to the federal government for your Part B coverage. Now, some key points about Medicare supplement plans, and we already touched upon this a little bit. Here's where Massachusetts differs from the rest of the country. What you read online about Medicare supplement plans generally does not apply to Massachusetts residents. We don't follow the general national schematic of Plan F, Plan G, Plan N, etc. We have 3 plans here in the state of Massachusetts. The other thing that you may read online about Medicare supplement plans is if you don't enroll any supplement plan when you first go on Medicare, you may not be eligible for one later in life. That is not the case here in Massachusetts. In Massachusetts, our supplement plans are guaranteed issued no matter when you enroll in it, and it is community rated. What that means is when you go to enroll in a supplement plan, the insurance company will never ask about your current or past medical history, and they cannot charge you more money based off of your current or past medical history, nor can they deny you coverage. The other important thing to know about Massachusetts supplement plans, it does not matter who the insurance company is. Each plan in each category offers the same benefits regardless of who the insurance company is. So in Massachusetts, we have 3 plans. However, you can only enroll in the middle one, Massachusetts Supplement Plan 1, if you turned 65 prior to January 2020. It leaves most people enrolling in Medicare at this point with either the core or the Massachusetts Supplemental Plan 1A. The core plan only covers the Part B 20%. You are still on the hook for the Part A deductible, and you are still on the hook for the Part B deductible. The Massachusetts Plan 1A will cover the Part A deductible $16 plus $100 per occurrence for you, and it will also cover the Part B 20%. Your only out-of-pocket expense on the Supplemental Plan 1A is the Part B $257 annual deductible. Now again, it doesn't matter who the insurance company is. A Massachusetts Supplemental Plan 1A from one insurance company is identical to another insurance company. They both cover all of the same things, and you can see any doctor, any facility across the country, regardless of who the insurance company is. In fact, the only difference between a Supplemental Plan 1A, a core plan from one insurance company to another, is the name of the insurance company and how much you're paying. All right, let's take a look at option 2, the Medicare Advantage plan. And this is where a lot of the marketing and a lot of the misconceptions and a lot of the confusion stems from. You've heard the TV commercials and the radio ads. They go something like this. No monthly premium, no deductible, no copay for your primary care doctor, free dental, free vision, free hearing, free transportation, free gym membership, free meals. That commercial leads you to believe everything is free. Folks, we know better than that, right? Not everything is free. The first question folks ask me is, Andy, how is it possible a Medicare Advantage insurance company is going to offer me health insurance with no monthly premium? Here's how it works, and I'm going to make up numbers for sake of illustration. The Medicare Advantage company, for example, goes to the federal government and says, hey, Medicare, based off of our calculations, we think it's costing you, the federal government, $5,000 to provide these folks in Massachusetts with their Medicare Part A and B coverage. We believe if they join our plan, we can manage their care for $3,000. Federal government says, fantastic. If that person enrolls in your Medicare Advantage plan, we will pay you the $3,000. The insurance company's happy because they're getting paid. The federal government is happy because they're effectively saving $2,000 and they're no longer managing your claims. So it's not that there's no monthly premium, but rather you're using the federal government as a pass-through to pay the Medicare Advantage company on your behalf. So the second question becomes, how is it possible for a private insurance company to manage your care for less than the federal government? And this is not a political conversation. Your Medicare Advantage company is doing it in 2 different ways. The first way, just like your current group health insurance, the Medicare Advantage company is going out to all of the doctors and hospitals and inviting them to be part of their network. And when the doctors and hospitals join their network, they are agreeing to a negotiated set of reimbursement rates. So the first way the Medicare Advantage company is managing your care for less money is through a negotiated set of rates with their doctors and hospitals. Now, some doctors agree to be in network and some doctors don't agree. And for that reason, we have HMO and PPO plans. Under an HMO plan, you have to stay within that insurance company's network of doctors. If you go outside of the network, the insurance company is not going to pay for your care. Under a PPO plan, you do have the option of going outside of the insurance company's network of doctors, But because the insurance company does not have a negotiated rate with that doctor or facility, they may be paying that doctor or facility more money, and therefore they're going to pass that on to you in increased copays or coinsurance. So the first way the Medicare Advantage company is able to manage your care for less than the federal government is through a set of negotiated rates. The second way they do it is while the TV commercials may be accurate in that there's no copay for your PCP and no deductible, there very likely is a copay for all other services. And just like your current group health insurance has a maximum out of pocket, that maximum out of pocket is your ceiling or your stop loss. You will never pay more than the maximum out of pocket for covered services in your copays or your coinsurance. Just like your current group health insurance, the Medicare Advantage plan also has a maximum out of pocket. That is your stop loss. So if you ever meet that maximum out of pocket in your copays or coinsurance, the plan will start covering 100% of your covered expenses. So some key points about Medicare Advantage plans. These are the plans that are known as Part C. They do replace your Part A and Part B coverage. However, Medicare Advantage plans do have to provide all the same services and coverage that your A and B does. And most Medicare Advantage plans include your prescription drug coverage. Many Medicare Advantage plans do offer ancillary benefits not covered by our original Medicare. And we do have HMO and PPO networks that we need to be aware of. I want to talk about cancer, heart attack, and stroke coverage for a moment. Medicare doesn't cover everything. For example, if you have an internal cancer diagnosis, you may want to receive some experimental treatment, or you may have to travel to receive treatment. Medicare is not going to cover that experimental treatment, nor will Medicare cover your travel. Additionally, you may have some additional expenses. You may need to have someone come in and help you with chores around the home. A cancer, heart attack, stroke plan can help protect your financial wellness and your well-being. We also have protection coverage options. Again, Medicare is the intersection of your health coverage and financial wellness. We want to make sure that you have the right health coverage and that your finances are protected from any major exposures. Okay, we have discussed what original Medicare is, what original Medicare covers and does not cover, and that you have two options to fill in the gaps. The question becomes, which way do you go? And if you're working past the age of 65 and you work for an employer that has 20 or more employees, your coverage is creditable. You may want to stay on your employer group health plan, or you may want to go to Medicare and choose a supplement or advantage plans. Important note, retiree coverage is not creditable, nor is COBRA. So if you are on a retiree plan or COBRA, it is in your best interest to enroll in both Medicare's Part A and B upon your 65th birthday. Okay, under what types of situations might your employer plan be desirable? For higher income earners, your Part B premium plus your income-related monthly adjustment might be such that your employer plan is more affordable. The second situation you might want to stay on your employer plan is if you have a younger spouse or other dependents that receive their coverage through your employer plan. Well, if you jump off the employer plan, we now need to consider what does that dependent's coverage cost and what does that coverage look like. And thirdly, if you're on expensive brand name prescriptions, you may have more favorable coverage under an employer plan than you will under any plans that we can obtain for Medicare. If you do decide to stay on your employer plan, as long as that employer plan is creditable, which is currently defined as having 20 or more employees, you may delay your enrollment in both Parts A and B. And when you jump off of your employer plan, that will create a special enrollment period for you to now enroll in Medicare Parts A and B without a late enrollment penalty. All right. You've either left your employer plan, you've retired, you no longer have access, you have to go on Medicare. Do you go on a Medicare with option 1, a supplemental plan, standalone prescription drug plan, or do you choose Part C, a Medicare Advantage plan? Let's talk about the various different situations. In our opinion, if you have a chronic illness, a chronic disease, a chronic injury, if you are predisposed to routine and frequent care or routine and frequent hospitalizations, Generally speaking, a Medicare supplement plan is going to be more affordable for you. It's going to help smooth that cost of care over the 12 months of the year via monthly premium payments. If you live in multiple parts of the country or in a rural area and your doctors are not in network with a Medicare Advantage plan, the supplement plan is a viable option. And again, the reason for that is you can seek care from any provider, any facility across the country that accepts Medicare. You no longer need to worry about doctor networks. And finally, if you're not worried about running out of money in retirement, a Medicare supplement plan just affords you the most flexibility and the most freedom. When might a Medicare Advantage plan be an appropriate option? You want to pay a lower premium or no premium. You still have to pay your Medicare Part B $185 premium. If you're in relatively good health and do not use health services regularly, Medicare Advantage plan might be a good option. You might want to use it as a backup for VA services. Again, if you're in good health, not using the plan regularly, if your doctors are in network, we understand that there's a network of doctors, Medicare Advantage can work well for you. However, it is important to understand what the cost structure is and what your potential expenses may be when you seek care. Again, while the TV commercials may be accurate and there's no copay for your primary care physician and there may not be a deductible, there likely is a copay for every other service. And it's important to understand what that cost sharing structure is. And it's also important to understand what your maximum out of pocket on a Medicare Advantage plan may be. That is, what is your financial risk or your exposure in an accumulation of copays and coinsurance? So if you like the access of doctors, you like the network, you like the idea of paying a lower monthly premium in exchange for paying copays when you use the service, and you like the idea of having all of your extra ancillary benefits provided to you under one plan, this is where Medicare Advantage fits and works well for folks. Now, let's talk about prescription drugs for a moment. And this is the same regardless if you choose option 1 with a standalone prescription drug plan or if you choose option 2, a Medicare Advantage plan that includes prescription drugs. Now, this is a major change for the 2025 plan year. You may have heard in the past this concept of a donut hole. Good news, that has gone away. There are 3 phases to prescription drug coverage. First, the deductible phase. Now, not all plans have a deductible, and not all drugs have a deductible for the plans that do. If your drug in your plan does have a deductible, you have to pay the deductible before the insurance company will cover your prescription. Once you have satisfied the deductible, you move into the initial coverage phase. During the initial coverage phase, you pay either a copay or coinsurance for some prescriptions. A copay is a set dollar amount, and a coinsurance is a percentage that you have to pay when you pick up your prescriptions. Now, starting in 2025, there is a $2,000 maximum out-of-pocket on prescription drug coverage. What that means is you will never pay more than $2,000 for your covered prescriptions. And if you do, you move into what's called the catastrophic phase. When you enter the catastrophic phase, you no longer pay a copay or coinsurance for your prescriptions. When you pick those up at the pharmacy, they are covered at 100% on your behalf. Plan selection and enrollment assistance. Again, what makes Medicare confusing and complicated is the amount of information and the sheer number of plans available to you. As your professional Medicare advisor, we assist in identifying the most suitable plan. We assist you and help you processing the enrollment to ensure it is accurate and submitted in a timely manner, therefore avoiding any potential gaps in your coverage. Lastly, we provide ongoing support throughout the year and into the annual enrollment period. How do we do that? Well, before we talk about how we do that, let's talk about where you can get some assistance for your Medicare advice. You can do it on your own without assistance. Again, there's a lot of information out there and there are a lot of plans to choose from. How do you know which plan is the right plan for you? You can use a ship or shine counselor who is usually a volunteer helping only a few hours per month. You can call an 800 number and talk to a call center. You can use a company captive agent. That is an agent that only works for one insurance company. Now, when you talk to a captive agent that only represents one insurance company, you're only going to get information on that one insurance company's plans. Finally, you can use an independent broker. An independent broker is somebody who represents multiple insurance companies and can help review your options across not only insurance companies, but also all the plans offered by the various insurance companies in your zip code. How do we help you? Our process is first we input your drugs into our software and estimate the annual cost and review the plan's formulary to make sure all of your prescriptions are covered. We overlay that by reviewing your doctors and your pharmacy access, and then we compare all the plans available to you in your zip code and we help narrow that down. We show you both option 1 and option 2. We literally take a piece of paper and draw a line down the middle of the paper. Option 1 in the costs are on the left side. Option 2 in the cost and benefits are on the right side. And we come back and we review the pros and cons of each. Once you have decided which option you want to enroll in, we assist you in enrolling in that plan of your choice, again making sure it's submitted accurately and on time to ensure there are no gaps in your coverage. And finally, we're available ongoing throughout the year for any claims assistance or any assistance understanding how to use the benefits. And finally, we reevaluate your coverage every year. During October 15th through December 7th is the annual election period. That is your opportunity to review your coverage and make any changes in the following year. Because your healthcare needs may change and because the insurance companies may change how their plans work, it is important to review your coverage annually. What is a good plan for you one year may not be the most appropriate plan for you the following year. The 3 truths of using a broker. Truth number 1, you never pay an independent broker for their time or their service. In fact, it is against Medicare rules for anybody to charge you money for Medicare advice. Truth number 2, you pay the same price and get the same coverage from the insurance company, regardless whether you do it on your own, use a volunteer, use a captive agent, or if you seek the assistance of an independent broker. And truth number 3, with over 25 companies to choose from, we aren't biased. As a licensed broker, our state insurance license requires us to work in your best interest. Protection coverage options. I've said it a few times, Medicare is the intersection of your health coverage and financial wellness. We want to make sure that you have the right coverage in place so that you don't go bankrupt or you don't have a situation where you can't receive coverage. But we also want to make sure you're not paying more money for coverage that you'll never use. Therefore, we help you understand what protection plans are available to you to put in place to cover what Medicare does not cover. Are you ready to create a partnership for your health coverage and financial wellness? You have already taken the first step by attending today's educational seminar. The next phase would be to schedule your free consultation to discuss your specific situation and to provide you with a review of plans available in your area that are a good, suitable option for you. That is your personalized Medicare comparison and cost summary. And finally, we provide lifetime support, whether that's for prior authorizations, understanding step therapy, understanding how to access any ancillary benefits throughout the plan. That is lifetime assistance that we provide to you as our client. Additionally, we provide free annual reviews, ensuring that your coverage from year to year is still the most appropriate for your situation. And as your situations change, we're available to help you understand what other options might be available. If you have any questions, reach out to us at www.benefitadvisorsgrp.com or give us a ring at 978-494-6611. The decisions you make today can impact your health coverage for a long time. Medicare is the intersection of your health coverage and financial wellness. It's your health, it's your wealth. Worry less, heal more. Until next time, be healthy and be well. Thank you.